Hello, this is Dr. Tom O'Brien. I'm about to take you on a journey around the world, discovering the underlying mechanism to practically every degenerative disease, to cardiovascular disease, to cancer, you name it. Why does it appear that our bodies are betraying us? You're about to discover the true cause of autoimmune disease and its true solution. This is betrayal, the autoimmune disease solution they're not telling you. You're going to learn from over 85 of the world's foremost experts, including scientific researchers who are considered the fathers and the grandfathers in the field of autoimmunity. And more importantly, you will hear from people that have turned their autoimmune conditions around and found optimal health. These are dire, life-destroying conditions that most people never recover from. Lupus, inflammatory bowel disease, colitis, Crohn's, multiple sclerosis, rheumatoid arthritis, diabetes, skin conditions like psoriasis, and also degenerative brain diseases including Alzheimer's and dementia and Parkinson's. You're about to find out what the true root causes are to these terrible diseases, what turns your body on to develop a disease, as well as what you can do to prevent them from happening to you.
I was having seizure-like events, and I'd have them several times a day. From the shaking episodes, I would go into paralysis, and then I lost my fine motor skills. And it was just a slow rotting away. None of the doctors knew what was going on, and half of them didn't care. It even started affecting the main nerve going into my hearing. So everything seemed super loud, and I'd hear this screeching noise all the time. They said, no, it's a conversion disorder. No, it's all in your head. You're just making this up. When they attacked my integrity and told me I'm a hypochondriac and I'm making all this up, like I want something, like that hurt. That hurt worse than the ailment was to see all these doctors, these so-called professionals, to tell me that I'm making all this up.
I was losing a lot of hair at an alarming rate, and I had tried a lot of things. Nothing was working. I wanted to find out what's wrong, because something was wrong. I had headaches for as long as I could remember, and I had skin condition. My fingers and toes and my heels were just always peeling, and that cleared up. So there's just all these things that I didn't know could be helped.
So how has this affected my family? This killed my father. When my father died suddenly, after the autopsy, the pathologist called me and said, "I don't know why your father died." And I said, "What do you mean?" He said, "Well, he had a heart attack, but there was no clot. And he only had 30% blockage in his left descending coronary artery. That's called the widowmaker, but 30% is not enough." He said, "I don't know why your dad died. We looked at toxicology screens, that's the law, I'm sorry, but there was nothing. We looked for needle marks anywhere in his body, there was nothing. I did lung biopsy to see if he breathed something, there was nothing. I don't know why your dad died." Second time in my career.
Like my heart dropping at the pit of my stomach when a friend that had overnight become an enemy challenged me to a back of the school fight when I was in grade 6, 12 years old. I felt like I could do nothing but show up because I didn't want to be ashamed. This guy, when he ran up to me and started laying punches into me, I thought that I was going to defend myself, but it felt like my fists were anchored to the ground. And then in this moment of just trying to struggle through this situation, I'd pushed him down to the ground, and I was trying to force myself to be the way I thought I should be. And I dropped my fists and I said, "I can't do this. I can't do this, man." I got up and this guy just kept laying into me, hit after hit, until the guys just stopped the fight, because it was just... I think about the lives of the people that are suffering. I think about the countless faces that I've never met. That's the reality that I want to see in the world. That's the reality that I love to see in my own life. I love to see a smile. I hate to see a tear. That's what this is about. It's about seeing the joy that will come into people's lives when your health is restored, when you can be free from disease.
Well, autoimmunity is a whole spectrum of disorders that all have very common roots, even though they show up in different parts of the body. And if you look at autoimmunity, it affects 80 million people in this country. When you lump them all together, from Hashimoto's thyroid disease to MS to inflammatory bowel disease to rheumatoid arthritis to psoriatic arthritis, and the whole spectrum of disorders are seen often as very separate things. But we now know that autoimmunity has common roots, that it's the body attacking itself, and that there's a reason for it. And unfortunately, most common therapies are designed to suppress or block the body's own immune system instead of figuring out why it's so pissed off in the first place.
It's kind of generally known, the concept of autoimmune is that the immune system is reacting against the body itself. So it's like an automatic process of the body rejecting itself. And it really seems like that's a very strange thing for our immune system to turn rogue against our host tissues and start to damage them. And I thought, well, what is an autoantibody? And we say, well, it's an antibody that our immune system produces against our own tissue, like anti-thyroidal antibody, or anti-mucosal antibody, or anti-brain lipid antibody with respect to multiple sclerosis. And I think our body is actually looking at these native parts of our plumbing and our machinery, and it's saying, oh, I'm sorry, suddenly you're a foreigner, and I'm going to produce a destructive thing from part of my immune system called the B cells that is going to attack those tissues specifically. Now that is kind of a paradigm shifting concept, right?
From my eyes, it's a misfire between what our immune system wants to do and what it should be doing. And now the immune system in our modern culture feels to me a lot like a group of teenagers with time on their hands. Like it's your birthday and everybody's singing happy birthday and you've got the cake, the candles are lit, and everybody's expecting you to just blow out the candles and you whip out your fire extinguisher. That's an autoimmune disease. It's an overreaction of the immune system just to a normal event.
I love the idea of having an early warning because knowing whether or not we have antibodies that might predispose us or that might be the early signs of a developing autoimmune disease, that gives us time to start dealing with all of the environmental factors that we have a great amount of control over that are also contributors to that disease.
I first awoke to the possibility of putting a chronic autoimmune disease into remission through my own experience, right? As is almost always the case for doctors who, go rogue. They do so because they have had an experience that has shown them a greater version of the truth than they were exposed to through their pharma-funded education, right? And I was diagnosed with Hashimoto's postpartum about 9 months after my first pregnancy, and had never had a health condition in my life, had been living really largely recklessly from a health perspective. So when I was diagnosed, I sort of saw it as a massive inconvenience, and I thought the idea of having to take a prescription for the rest of my life was just a total pain I didn't want to deal with, right? And I went to a naturopath, not because I believed in alternative medicine, actually, or even had anything, kind to say about it, but because I knew it was the only way out, because I knew what conventional medicine had to offer me, and I knew that that was a lifelong prescription.
But at the time when I was going through my autoimmunity, I didn't know about functional medicine. And so I went through conventional treatment. I had Graves' disease, which is an overactive thyroid, an autoimmune disease of my thyroid. And very long story short, after being on toxic medication that nearly caused my liver to fail, and then ultimately having my thyroid ablated with iodine-131, I no longer have a thyroid. So, it's really my mission and my passion to help people to never have to be in my boat.
Earlier this year, he'd been to 60 different dermatologists. He had such a rare form of autoimmune skin rash that one of the dermatologists invited him to a conference and asked him if he would sit in, and he sat in, and for 4 hours, all the dermatologists at this conference came in and were looking at him trying to figure out what he had. And you know what he had? He had gluten sensitivity, and it was triggering an autoimmune response. It was coming out in his skin. And we were able to get rid of that rash that 60 doctors, 60, couldn't figure out. We were able to get rid of it in less than 6 months.
Autoimmune diseases, like other diseases, atherosclerosis, cancer, they are multifactorial. There is no one factor which determines if you will get the disease. And therefore, it's the combination of factors which join together in concert to induce the disease. There are many factors. There are genetic factors, there are hormonal factors. 75% of the diseases prevail in female. It means that they have something, a risk factor in their body which enhances the immune system so that they will develop autoimmune disease. There are immune deficiency factors, and there is also, or there are also the environmental
In many ways,
factors.
we're very similar to the family doctor of old. And that is, we have really strong relations with our patients and their families, and we spend more time with them because we want to understand why they're sick, not just that they are sick. So yes, we diagnose disease, and we do physical exam, we do laboratory tests and x-rays, all those things to diagnose what's going on. But rather than say, okay, now let's give them a drug, we say, well, no, are there some natural approaches we can take to help the body heal
What's
itself?
the typical patient that comes in to see you?
Well, they have many complaints together. They have they want to lose weight, they have migraines or headaches, they have allergies like sinusitis, rhinitis, they have gut problems like constipation, bloating, and like all the body is being attacked. It looks like that all the body is being attacked by something they don't know, they have no idea.
Here's a drug. This is the answer you've been looking for. We're told, take it for the rest of your life. We're not told, where is the problem coming from? This is not the solution. This is just helping us function a little bit better. But where is it coming from?
If we look at the leading causes of death and we say, okay, how do we treat these things? Like what the system that we have, what do we use to treat these leading causes of death? Well, we use medicine, right? But medicine is the third leading cause of death. Does that make sense to you? That's data. I mean, I didn't make that up. That's raw empirical data. So what it tells me is we're doing the wrong thing. And maybe we're not doing the wrong thing 100% of the time. The system promotes that drugs are the only thing that can treat, cure disease. That's what, if you look at, perfect example, look at a bottle of supplements. On the bottom of it, it's going to say FDA disclaimer, right? This product was not intended to treat, cure, or diagnose any disease. Why does it have to say that? Because medicine ensures that nobody else has the thought process that anything other than drugs can treat, cure, or diagnose disease. If you think about it from a business perspective, like I'm a businessman, I'm also a doctor, and I'm also compassionate, and I think there are a lot of people out there like that. But from a business perspective, medicine is the only business that continues to grow at an exponential rate despite failing miserably its customer. What other business can you think of other than government that has that track record? I use the word diseasifying. We've diseasified normal processes, and we've justified that humans should be functioning at 100% all the time, and if they're not, we're going to call whatever that is a disease and create some kind of treatment.
Is used in the case of autoimmunity, because the very brutish premise is you want to destroy the immune system. So they're using some of the very same agents. And then of course cancer, you're using, as we know, right, conventional warfare, you know, chemo and radiation. It's like an insane model where not only do you feel betrayed, you have this condition, your body's attacking itself, but now the conventional medical system's saying we've got to blast this enemy within, and they literally, the collateral damage is like off the chain.
We have an outdated clinical model, and it's really based on, you have a disease, here's a pill. Yes. You have a cold, take an antibiotic. And it has not served us well. It got us to the bottom of the list.
That's right. Look at the result.
So doing a root cause analysis, looking at, you know, a systems-based approach to the body, looking at, okay, why are you run down and you got exposed to a virus maybe when you flew to Europe last week and now you're sick with the virus, you know, just trying to understand what are the levers here? You know, how much stress do you have in your life? How are you dancing with that stress? How much sleep are you getting?
I got a friend who I went to school with, and he got colitis, and you know, dealt with colitis, went down the regular route, and suddenly like three feet of his gut was like taken out. So like he'd lost a certain part of his body, and this is a friend that I went to school with, who I've known since I was like 7 years old, and the plan there was just, you know, there's no preventative action. Suddenly you have colitis, you're gonna have 3 feet of your gut out. And then now, I continue to see on social media that he's in and out of hospital still, you know, having operations every year, had problems with, you know, having a family. So I see that, you know, colitis, I see doctors in functional medicine every day reversing.
I had a patient just last week with rheumatoid arthritis, which started with me like a year ago. and she was taking many medicines and lots of pain, no improvement at all, and she was in the highest dosage possible. So there was nothing that her doctor could do for her other than he was already doing. And then she came to my office. It was in July last year, and we started all the protocol, which is an individualized protocol. And when now she came back, well, every month or every 2 months she was back to the clinic, but then I asked her this last visit, how are you feeling? What was your improvement during this year? She almost cried. And for the first time, I think it was the first time she was not with her husband together. And she told me, my husband prays for you every day because he doesn't hear me complaining and moaning and crying.
People come to see a clinician because they hope that that clinician's going to walk down a road with them to help them. And, you know, for me, I've always been taught that my life is about service. I think whether I go get my hair cut, somebody's serving me, right? They're making me feel better about myself by cutting my hair. I go buy new clothes. It's because they make me feel good for a minute, right? I think we're all about service. And I think that's really what kind of binds this kind of functional medicine group or integrative medicine groups together, is that curiosity where we're always kind of saying, how can we serve better one person at a time?
To really high quality, excellent medicine, but also he's not only an educator of patients, but he's an educator of
information he shares so seriously. He researches it, he studies, he comes up and he presents it in ways that are easy to understand.
You know, there are various heroes in that story, but I realized that Dr. O'Brien is someone that I have the most respect for because he took that hero's journey when very, very few people were.
I didn't know what kind of impact you'd had on James's life. Yeah.
Thank you.
Yeah, man. Yeah. I don't think you you saw that through when you thought about doing what you did. I don't think you saw that would result in something like this.
No, it's not necessary. You know, you just follow your bliss. You just do what you know you have to do. And then the ripple effect occurs, as James said. We're brothers. There's many of us. The three of us, we're brothers.
Wow. Yeah.
Everyone that sits here for these interviews, we're all family. We're all trying to carry the message out, you know, one way or another in our worlds.